Phil Keating live for us in Miami. Phil, thank you. With us now is Dr. Michael Anderson. He is the Chief Medical Officer at Cleveland University's Hospital's Case Medical Center. Dr. Anderson, thanks for joining us, sir.
Trace, good to be here.
In California, we have this new rule that says the doctors really have to treat patients in a timely manner or they can be penalized. And I spoke to a doctor friend of mine who said, good luck. There's only so many of us. Are you expecting similar stresses and pressures in Ohio where you are and across the country?
Yeah, I think we've been preparing for healthcare reform, whether it's the institute of these healthcare exchanges or health insurance exchanges or healthcare reform in general. We've been preparing for a while. I'm not exactly sure if we know exactly how many patients are going to get into our system. We've been preparing to get patients into medical homes, to increase our cadre of primary care docs that can see folks, to make sure that we're standing up things like accountable care organizations. So we've been doing a lot of preparing to be ready for healthcare reform, but I still think there's some unknowns as to how many patients we're going to see and how to handle that volume of patients.
And maybe where you are, it might be different, and maybe there's a way to handle it. But as you go out to the rural areas, doctor, of this country, I mean, what happens when you only have a few doctors and you have a lot more people that are involved in the insurance programs there?
Well, you've hit the nail on the head, and I think in general it's good that we want more people to get health care insurance. We want people to be healthier. We want them to see their primary care doc before their disease progresses and they need urgent or emergent care. But the number of primary care docs, the number of clinics that are set up across the country, I think is a real weakness in this entire debate. And I think we as a country need to look at how are we training primary care docs, how are we using nurse practitioners and physicians assistants as wonderful additions to the system. I think there's some big questions. It's great to get health insurance, but access is important.
Would you be in favor of maybe having Congress come on board and fund some of the training programs for these doctors? Clearly, we are going to need more family practice docs as we go forward. Is there a mechanism you believe that might help that process?
Boy, you've hit on one of my favorite topics, and that is training the next generation of physicians, something called GME, Graduate Medical Education. I really believe Congress has to look at how we fund GME, how we allocate the spots, how we look at this in a holistic viewpoint, because we have a real dearth or a real weakness in the number of primary care docs that we have, and we've got to take that seriously, and I believe Congress has to look at this.
And we got to go, Dr. Anderson, but will this change the way that you practice medicine, do you believe?
I think for the good. I think focusing on quality and safety and efficiency, making sure we do things at the lowest cost possible while assuring safety, I think that's in the long run a good thing.
Dr. Anderson, thank you, sir. I appreciate it.
Pleasure as always, Trace. Thanks.
Well, more details now on the partial shutdown of the federal government. We told you earlier that hundreds of thousands of federal employees are not getting